Congenital heart disease affects millions of people, and some local doctors are on the forefront of treatments and awareness to help patients lead longer and more productive lives. Our own Chris O'Connell is one of those patients.
And he joins us right here on the couch. We also have Ashlyn. How are you?
Good, how are you?
She has a whole story herself. And Dr. Yuli Kim, medical director of the Philadelphia Adult Congenital Heart Center over at Penn Medicine. Welcome to you all.
Thank you.
I think a lot of our viewers know about your story, Chris, but remind us.
Yeah, 7 years ago, I suffered a stroke that left me mostly blind in my left eye. We thought it was an optical condition, but it ended up being a congenital heart issue. They found at 48 years old, I had a quadricuspid heart valve. Which
From the beginning of your life,
From
right?
the beginning. I was born with it.
Yeah.
But they didn't find it out until later in life. So now I'm being treated with antiplatelet therapy. I've had some procedures. I may have more. But at the awareness, I got to keep healthy so I don't have another stroke. Ashlyn here was born with it, and she had 3 open heart surgeries before she was 3 years old.
Before you were 3?
Yeah, before.
So when was it discovered? Right at close to birth?
Actually, most kids are diagnosed in utero. I wasn't actually diagnosed until I was 4 weeks old, when I wasn't feeding, I wasn't gaining weight, like a normal baby does. And I had my first surgery at 6 weeks old.
What exactly was wrong with your heart?
I have hypoplastic left heart syndrome, which is actually what's on my t-shirt.
Yeah.
It's a fancy way of saying the left side of my heart didn't develop properly. You can see the ventricle's really tiny. And then there's a couple other small things like the aorta's really little, and you have a patent ductus arteriosa.
Yeah.
And so how was it growing up for you then?
I've not noticed anything. I mean, I say I don't know what it would be like not having a heart condition, but growing up, I didn't feel limited. I didn't feel like my peers could do more than I could, and I don't feel that way as an adult. I mean, I'm active, I'm healthy, I teach spin class, I work out every day.
So, doctor, what did they do for her?
Oh, she had 3 palliative surgeries before the age of 3.
What's that mean?
Basically, what they did was they had to change the plumbing of her heart so that she was only born with half a heart. And so they had
Where
to
do you
change
get the other heart
plumbing.
then?
You don't get another heart. You have to change the plumbing in such a way that the child can survive.
And thank goodness, because I mean, a spin instructor workout, that's amazing. But the interesting thing, Dr. Kim, is we're hearing their stories, but every 1 in 100 people, they have some sort of heart issue?
That's correct.
That seems like a lot.
It does.
It is a lot. It's sort of hiding in plain sight. And I think one of the things that I think is really important for people to understand is that, congenital heart disease is not like the type of heart disease that we think of when we think about heart disease. We think about maybe blockages in the coronary arteries, heart attacks, strokes. This is very different. This is something that you're born with. This is something that, that you had since day one.
But the interesting thing is, if it's every 1 in 100, that is a lot. And it sounds like you only really know unless there is an issue. Is there any other way to find out?
He didn't know.
Right, until he was an adult.
Well, these are 2 examples of how you can present. You could present when you're a baby, or even in utero, like Ashlyn said, or you can present as an adult. And, thanks to all these advances in surgery and medicine, we now have the expectation that most of these babies will make it to adulthood. So it's very common. It's all around us. And like I said earlier, it's hiding in plain sight.
And the reason why the Adult Congenital Heart Association exists, because years ago, this would be a death sentence.
Yes.
The treatments and pharmaceuticals are now, we're living longer. People like Ashlyn are living longer productive lives. Now these children are now adults, and that's how what we're trying to do is create awareness for adults who were children who now need that care.
And one way to do this is to have a walk,
Yes,
right?
yes.
And when is this one coming up?
June 3rd in Langhorne, we have the 1 in 100 walk at the Core Creek Park in Langhorne next Saturday. A lot of people, doctors, stakeholders, patients like me. I'll be emceeing the event. Ashlyn is going to be there. Her mom's coming up from North Carolina.
Yep.
So it's a big walk to raise money and awareness, again, for people like us, to raise awareness, to be heart healthy, to take that, the best thing, a stethoscope. We were talking the most basic medical instrument can pick up something like this.
All right, let's go. Are you going to go?
I'm emceeing. Of course I'm going. June 3rd.
I'll be there.
You will be too?
Yes.
I have to say something at it too.
Oh, you have to talk?
I do, yeah.
Well, we can't wait to hear
got
more.
through
And
this.
there's the information if you want to register and also learn more about the organization and donate.
Thanks, y'all. We'll come
Thank
right
you,
back.
guys.
Don't